Building trust is an important ingredient when patients resist the doctor's plan. This patient has diabetes and has come to get the results of his blood test.
Do you do your own testing?
No, I don't really.
Do you think you should?
But I come to know when it goes up. That's how I just come to know.
How do you know?
Well, my body tells me, speaks to me. Then I feel better. I know it is,
How do you feel at the moment?
I feel weak at times.
Mm.
That means my diabetes, blood sugar is up.
Mm.
But then I sometimes feel energetic, so that means things are a bit better.
Mm.
So,
How would you feel about having a session with a nurse and for a period of time doing the blood test? Not saying forever, I don't want to get into that, but I would like to see, I'm not distrusting your feelings, but I don't know about it, but I don't know that they're accurate enough. And just for a period of time, I'd like to know what the sugar levels are doing. It would help us to advise you and also think about your treatment.
okay, if you think...
Is that all right?
If you think it's necessary.
Yeah, I do. I'm not saying you have to do it forever and ever, but just for a period of time to let me see what's happening.
The GP has suggested the patient should start testing his own blood sugar levels. Notice the way he structured his request to the patient. I still think we need to. Then asks about testing. Do you think you should? Then, how would you feel about having a session with the nurse? Persuading is usually most effective when done indirectly, so the patient doesn't lose face.
I'm going to ask the nurse to see you. I hope she'll be able to see you. We've got a nurse off today, so it's a bit busy. I'll just go and have a word with her, but maybe either tomorrow or Friday, just to go through the testing with you. And I'd like you to test perhaps every other day.
You have to send the samples to the...
No, for you to test at home. It's a little finger prick.
Oh, I used to do it myself.
I know you did, I know. Well, I want you to do that again. I just wanted to go through it.
I don't like that.
I know.
I think there's some more advanced things now.
No. Well, you can discuss it with the nurse. She has much more up-to-date information than me. But I don't want you to do it every day, but I'd perhaps like you to do it every other day. I just need a picture for a week or two of what your blood sugars are doing, you see. I'm not asking you to do it for all time.
Notice again the indirect ways that the GP has proposed action. I would like you to... And he's again repeated that this was a temporary measure when the patient resisted. Overseas doctors are sometimes concerned about admitting that they don't know the answer to a patient's question. But here, Dr. P is quite happy to refer his patient to the nurse, who is a specialist in this area. The authority of the UK-based doctor is different from that in other countries. Here, doctor knows best has to be worked for, negotiated. Doctors have to inspire trust and confidence in patients. The doctor's authority is not taken for granted.
I would like the nurse to see you.
Every day?
No. I'd like her to see you to just go through doing the blood tests for a little while and recording them for me. And I'm going to put you on an increased dose of glabenclamide, and I'd like to see you in 2 weeks' time, and you'll have a little paper with some figures on it for me. Okay. All right? We don't have to do this forever and ever, but we need to do it now.
Okay.
Is that all right?
Okay.
Are you cross with me?
No, I just don't like it.
Dr. P is quite firm about the importance of testing. But once this is agreed, he and the patient have a little joke about the fact that the GP has persuaded him to do something he didn't want to do.